uh, I told in the last class,
Yes, sir.
because there are very less number of people who joined the class. So I asked you कि in the next class I will ask uh, some policies in India which are initiated but failed.
Yes,
Whatever
sir.
the reasons, whatever the reasons I told you, कि there are
Yes,
at
sir.
least four elements which are very much required in the any health policy to make it sustainable.
Mm-hmm.
So as such, only you have joined, you have searched some any policy Indian health policy which was started and due to some reasons that policy couldn't sustain for a
Yes.
longer period
Sir, I
or some more.
think first one was national population policies because their target was that कि fertility 2000 तक मतलब 2000 में प्रपोज हुई थी कि 2010 तक जो स्टेट्स हैं जैसे बिहार उत्तर प्रदेश कम हो जाना चाहिए
Hmm.
बट वो नहीं हो पाया मतलब पॉपुलेशन कंट्रोल में नहीं आ पाया इंडिया का
Okay.
नेशनल पॉपुलेशन एंड आई थिंक एक जन अशुद्धि स्कीम थी 2008 में आई थी
Uh,
कि प्रॉपर मेडिसिन मिल पाए पुअर लोगों को जेनिक
hmm.
लोगों को पर वो भी नहीं हो
Hmm.
पाया
Hmm.
था सर
So
और
now
बाकी
you explain जन औषधि में स्कीम की हम बात करें, है ना?
हम्म
तो
हम्म
now we have to discuss कि why this was failed. And yesterday, day before yesterday, I told that there were four key element kind of thing for making any health policies successful and the sustainable. One is the
हम्म
accessibility, affordability, equity,
एफोर्डेबल
and the acceptability. These are the four elements which are very much required for any successful policy. So now, if we analyze this Jan Aushadhi scheme, hmm,
यस सर
now we talk about the accessibility part. What is your comment on the this accessibility part? Jan Aushadhi scheme में?
सर इसमें ये था कि मेडिसिन हर एक तक पहुंच पाए बट पॉपुलेशन अगेन वो हो सकता है कि लिमिटेड रीच इन रूरल एरियाज मतलब जो अगर रूरल एरिया
हाँ,
वहां नहीं पहुंच पाया
हाँ,
और
yes.
जैसे कि
This is the one
मेडिसिन
accessibility point. Yes, yes.
कई ट्राइबल्स जो एरिया रहते हैं सर वो मेडिसिन
हाँ,
मॉडर्न मेडिसिन पे विश्वास भी नहीं करते उनके अपने एक पैथी टाइप के
नहीं, नहीं,
उसमें
नहीं,
वो
नहीं, नहीं,
फॉलो करते
we come one by one. This is one point we have told into the accessibility because this the Jan Aushadhi medicine these are available in it is not easily available in the remote areas and the hilly areas and
हैं
tribal area. That is the accessibility part. Second word, second element is affordability.
अफोर्डेबिलिटी
Okay, affordability is not issue in the Jan Aushadhi. It is cheap, but it is unavailable. Maximum time, if you go to the some Jan Aushadhi store, maximum medicine they are going to be unavailable. Third point is we talk about the equity. Again, equity may if you see the distribution of this Jan Aushadhi cane, they are not not equal distribution. I mean, urban area may you get more Jan Aushadhi kendra, while as in the rural area there are less number of the urban these Jan Aushadhi kendra. So equity is not there in this establishment of the Jan Aushadhi scheme also. And the fourth one is the accessibility, which you very correctly told, because people they trust that these are the generic medicine and they are not effective. They don't have so much of trust in these particular kind of medicine. Okay, Jan Aushadhi medicine. That is one very important. The moment you tell, this is a Jan Aushadhi medicine, the people start saying something like that कि पता नहीं क्या है कैसे everybody thinks कि it is not going to affect at all, है ना?
यस सर
So, so these are 4 points which Jan Aushadhi scheme is all there. It is existing, but you come into the field, it is not very much successful as it was expected from the government. Okay, and responsible also the government policies and all that because availability, quality, these all can be ensured by the government. But that is again a lapse from the government who are in the power or who something like that. One more scheme, if you have heard, that is a very famous historical scheme, that is family planning program in 1970 when the emergency was imposed, forced sterilization that was started by this person, late Shri Sanjay Gandhi. Okay, this program was started, but later on he used to uh, uh, utilize this coercive sterilization, means forceful sterilization, and that ultimately leads to the public outrage and the distrust also. And later on, government has also bent to the back seat, lost the election and all that kind of thing. So वहाँ पे भी it was something like that. If we talk in the terms of the accessibility, it was actually overly aggressive implementation. Means accessibility was not issue, but it is the overly aggressive implementation. Well, people were just caught from their home, people were sleeping, and they were just picked up into the ambulance for the castration and sterilization operation kind of thing. Okay, affordability is free of cost, but definitely free of cost means that there must be some kind of consent. It should not be imposed. So it was free of cost, but it was forcefully imposed. Equity means normally जो बेचारे uneducated थे and who are the marginalized people, जो गरीब आदमी थे, they were the easily target for this forceful sterilization. Of that is the main thing. Okay. And उसका result क्या निकला कि after such kind of incidents, for a longer period, there was some stigma regarding this family planning and all that. And that's why Indian population growth rate जो होना चाहिए, whatever the population growth is supposed to be that, it was always on the higher side. But if you see the second aspect also, that time Sanjay Gandhi or Congress party, they were criticized. But if you see, if he has not forcefully implemented this scheme, what would be the situation of the India today? Because even doing all these kind of things, we could be cross 130, 140 population. So maybe this is the another aspect ki, that forceful imposition or the implementation of the public this family planning program that helps in reducing the Indian population or helps in control the Indian population. वो भी एक थोड़ा सा डिबेटेबल इशू है. तो हेल्थ पॉलिसीज कई बार ऐसी बनती हैं जो गवर्नमेंट ये सोच के बनाती है कि इट इज गोइंग टू बी effective for the community, but finally, due to some poor work or the you can say the poor insight fail. One more scheme is that is the ICDS, Integrated Child Development Scheme. It was not completely failure, but it has also faced some kind of partial failure. उसमें there were a lot of reasons. Anganwadi center was not there. Nutrition, which is supposed to be there, that was not sufficient. And again, the equity part, marginalized people, poor children, they were not getting benefited. And ownership वगैरह नहीं होने से there was no ownership and involvement in the program by the community. It was not very successful. But later on, some modification has been done, and the policy is running like something like that. So these are the four things which you should always remember: accessibility, affordability, equity, and the fourth one is the
Accessibility.
हाँ. So these four things is very important for any kind of public health policy. Now we talk about some this national health policy. What is the national health policy, and what is the need of this national health policy? So if you see, the first national health policy that came into the existence में वो कब आई? After the 36 years of the freedom. First health policy that came into the existence in 1983. And क्यों ये policy लाने का जरूरत पड़ा? There are a lot of after this freedom, after this independence and all that. There are a lot of बहुत सारे challenges थे field में. And one thing is that जब हम बात कर रहे थे उस समय यूनिवर्सल हेल्थ कवरेज की, तो that is the one thing which is required कि सभी लोगों तक हेल्थ पहुंचे. For that this national health policy requirement is was being felt, and it was started. There a lot of health inequities is there after the independence. If you see, there are a lot of inequities. Maximum population they are living in the rural areas. Distribution of the population into the urban and rural areas, and even different states. If you talk about this northeast states, there are very scarce population, है ना? And socio-economic group. We after the independence, it was lot of disparity. So to address all these health inequities, some kind of intervention is required. So that is why this national health policy was in the practice, or was implemented, or was initiated to meet these kind of requirement. Okay, for disease prevention and the control, uh, at the initial stage after the independence, a lot of communicable diseases are there, and people were just died because lack of the treatment, lack of the facilities available. Lot of cases are were of the cholera. Many, the whole village was just tarnished because of this cholera, measles, all these kind of things. Lot of polio cases. So disease prevention and control के लिए this national health policy has significant role. फिर इसी national health policy में need of vaccination program started, various health promotion program started, prevention program, all these kind of programs they started. फिर if we talk about the healthcare infrastructure, at initial it was also not very in the good shape, and that was required to be strengthened. So for that also, healthcare infrastructure strengthening, this national health policy is various kind of objectives, various kind of programs to strengthen the health care infrastructure, as well as it also needs the establish emphasize the health workforce development. That is also very important, because the doctors, paramedical staff, nursing services, all these staffs, they were very much required. And this national health policy that incorporated all these issues and how to sort out, and they made the policies and implemented the policies to meet all this requirement. फिर then we talk about this medicine, traditional medicine and the modern medicine, Ayusha. इनका integration is also very much important, because in India you cannot dependent on only the allopathic courses or the modern medicine. Still, many people they believe in this traditional medicine, Ayurveda, yoga, Unani, Siddha, homeopathy, all these kind of things. So integration is also very much required. We have to understand ki where is the how these two pathies, Ayush and the modern medicine, can be integrated to fulfill the requirement of the community. Then we talk about public health research and innovation. That is also very important thing. So this national health policy, they just catered for this. They have initiated, they have promoted public health research and a lot of innovations which came into the existence. Lot of things. So if you take the example of healthcare innovation, we can think about this. मामूली सा we can talk about this disposable syringe. Initially हम जब इंजेक्शन वैक्सीन वगैरह लोग लगाते थे, इसको पानी में उबालते थे, स्लाइस करते थे. लेटर ऑन डिस्पो वैन आई कि आपने एक बार इंजेक्शन लगाया, उसको फिर आपने फेंक दिया. एंड नाउ आपकी जो आपकी सिरिंजेस आ गई, वो किस टाइप की आ गई है? देयर लॉक काइंड ऑफ सिरिंज. वंस यू हैव लोडेड, इट इज नॉट गोइंग टू बी यूटिलाइज इन एनी मैनर. मतलब वो लॉक हो गया, उसके बाद इट कैन नॉट बी यूटिलाइज. ओके, तो धीरे धीरे इस टाइप के इनोवेटिव इनोवेशन आए. जैसे वैक्सीन में पहले वैक्सीन कैरियर होते थे, डिब्बे होते थे, बर्फ होती थी, उसमें आइस होता था. फिर धीरे धीरे आपका ILR आया, आइस ब्लाइंड रेफ्रिजरेटर आया. फॉर व्हाट? जो रिमोट एरिया में जहाँ पे इलेक्ट्रिक सप्लाई उतनी नहीं है, तो सो दैट ये ILR जो है, एटलीस्ट दे आर प्रोवाइडिंग द protection, they are providing the temperature to the vaccines, required vaccine, for 8 to 12 hours in the absence of the electricity. So that ILR is there. Abhi recently you have heard this drone services. They are also started in various areas of the Ladakh to supply medicines, or sometime to supply the blood and all that kind of thing. So these are some innovations, or some things which has been come up, and these innovations are the result of the research only. Okay, no innovation can be just is developed. It is a part of any research. Maybe Sometimes it may be intentional also, sometimes it may be unintentional, or some kind of side effect also. Side function maybe that maybe becomes a innovation. Okay, तो वो चीज, इन सारी चीजों को प्रमोट करने के लिए भी कंट्री ने बहुत सारे इनिशिएटिव्स लिए हैं, और बहुत सारे इनिशिएटिव्स हैं जो
Hello, sir, you are not audible.